Hello, everyone. We are an ASEAN task force assigned to create a dengue prevention plan in Cambodia. My name is Jillur, and I have with me my amazing team members, Hannah and Portia. So according to World Health Organization, children less than 60 years old are at most risk of getting infected with dengue. But the FDA has recently approved a vaccine, Dengvaxa, that is applicable only to the children who are between 9 to 16 years old and those who had previous dengue infection. So we do not have any vaccine yet for children less than 9 years old. In 2019, Cambodia reported a whopping 66,000 dengue cases, which was 8 times more than what they were reported in 2018. So how does this dengue virus spread? The mosquito, Aedes mosquito, typically bites during the day, particularly in the early morning and at dusk. The mosquito breeds mostly man-made containers. So that's where most problem lies in. And as you can see in this picture, Cambodia has a lot of trash, like any developing nation that you can think of. Let's look at a few of these statistics. So in the capital city, Phnom Penh, they generate about 3.65 million tons of trash every day. And people in Phnom Penh uses about 10 million plastic bags per day. Of all the trashes generated in Cambodia, 21% is plastic. And the most shocking thing is 50% of these waste pickers in the cities are children who are also most vulnerable. And that's where we come in as an ASEAN task force. The name of our initiative is Dengue Response for Environmental and Educational Action Manifesto, DREAM.
Great. So while we're thinking about our initiative, we really want to take into consider the socio-ecological model. So at an individual level, we really want to be focusing on infants and children, the people who tend to be most at risk. On an interpersonal level, we want to be engaging with people who are in contact with those infants and children on a regular basis, like parents and youth who are also at risk for getting dengue. On a community level, teachers have a huge impact on really educating and teaching the community, which we'll talk about later. So we really want to engage them. And then on a societal level, we really want to engage with policymakers to make sure that our initiative lasts through time. Great, so on this side, you can see a goal breakdown and an intervention breakdown. For our goals, you can see that we want to decrease mosquito breeding grounds, such as basically the trash that can pool up with water. So for that, we're going to talk about the Anti-Dengue Permit. Another goal is increasing confidence in the dengue vaccine. So for that, we're going to talk about the Dengue Awareness Month. And then lastly, we're going to talk about promoting dengue prevention behaviors, which we'll be engaging teachers with, and then also really inspiring and encouraging children to get on board with that. Great, so like I said, we're going to jump right into the society part. So a big part of Cambodia is actually construction zones. It's a booming industry in Cambodia. Actually about $6.5 billion per year is spent alone on this industry. In this picture, you can see that construction zones actually collect quite a bit of water. At the bottom of the screen, you can see some mud that can collect water. There's some plastic and trash all around that can also be places to collect water. And remember that this type of mosquito actually prefers these man-made containers. So this can be a really big problem. So what we propose is introducing the Anti-Dengue Permit. So this would be a permit that each construction zone will need to renew every 6 months. And what exactly will this permit ask that they do? Well, first of all, we want to ask them to drain any water that they might have just sitting, maybe any dirt that's collecting water. We want them to throw away trash and dispose of trash properly so that it can stop from collecting water. We want them to put away worksite materials such as buckets, hats, again, so it doesn't collect water, And for anything that they're unable to put away, say if they're digging a trench and they're unable to drain that water, we want them to use mosquito control product so that this cannot become a breeding ground.
Great. And that's where we come in with the anti-dengue permit violation fee. If anyone violates the anti-dengue permit, they have to pay from $1,000 to $10,000 depending on the type of violation. And we are hoping to generate a lot of money from that. So the money that will be generated from anti-dengue permit will be spent on these four things that you can see on the screen. And we are giving, as you know, Cambodia is a developing country, and there may be corruption may be prevalent in that part of the society, that part of the world. So that's why we are giving the city autonomy of a two-third of the money that will be generated from the anti-dengue permit. So city council will have autonomy of spending 30% of the money to inspect the sites, construction sites as well. And about one third, which is a 35% money, will be spent on destroying breeding grounds. As you know, in Cambodia, so what happens is a lot of capital city and a lot of big cities can afford to deploy people with large tank of sprays and mosquito repellent sprays to to kind of clean to clean the area. But most cities do not have money. We are hoping that this anti-dengue permit may bring some revenues for most of the cities in the country. And the rest of the one third of money, we want the city to spend on schools to incentivize the teachers and kids, and 10% on giving away free repellents and bed nets to among its residents.
The next goal and intervention of the social ecological model we want to highlight is community. By increasing confidence in dengue vaccine, we want to implement a dengue awareness month to celebrate vaccine awareness. And so, as many of us, we are already familiar with the HIV and AIDS Awareness Month and how effective this data is. So, based on our research, we also found that in the Philippines, they have a Dengue Awareness Month. And so, we propose that Cambodia should also have one. This month will be held annually since the peak season in Cambodia is between May and October. During this month, we want to offer several activities that will take place, such as seminars and panel discussions and stakeholders booth. And all of these participants and individuals will be through our partnerships. And then also we want them to take a dengue pledge to just to stay informed and to keep themselves and their families safe. And then as an incentive for the kids, they will receive free repellents and bed nets. Next. Our goal on this slide is to celebrate vaccine awareness. As you can see, individuals that take the vaccine, they will receive a beautiful sticker as the one that's on the screen, and it will say "I am dengue free" in the Cambodian language. So basically, we want to do this to encourage citizens to use social media and use our filters and different frames through Instagram and post it on their stories, so that other people can know that they are taking this dengue seriously.
Great. So the last goal that we really want to focus on is promoting dengue prevention behaviors. So like I said, we're going to start with talking about how we're going to educate teachers. So an important statistic is that actually 97.9% of children 6 to 11 years old attend schools. This shows that teachers really do have such a high impact in these different communities. And if we're able to reach these teachers, we're able to educate a community of people who are really targeting these children. So that's why we're going to implement the dengue prevention training. So this will be an online certificate course that teachers will be able to take to learn about a couple of things, such as dengue transmission, the life cycle of a dengue mosquito, and the methods to prevent the spread of dengue. So when we talk about methods to prevent the spread of dengue, what we exactly mean by that is teachers will learn how to encourage kids how to use bed nets, bug repellent, how to use clothing or what type of clothing to wear that will be best for them, and destroying breeding grounds. Like we've mentioned a couple times before, mosquitoes really do prefer these man-made containers. We're actually going to be partnering with the Coconut School Foundation. It's a school actually almost entirely made of recycled materials. And they've been able to really inspire kids to get excited about recycling. We're going to use them to help us with educating these teachers. Lastly, we're going to be talking about how we're really going to inspire children to promote dengue prevention behaviors. This will be through the Bring Trash, Get Toys initiative. This is an initiative at each school. Each month, kids will bring in recycled materials, and then whoever has the most recycled materials gets to get a toy from one of our partners, Husk Cambodia. Now, Husk Cambodia actually makes these toys out of recycled materials, so that's why these kids are incentivized to bring these recycled materials in. Great, and a big part of our group is we really want to focus on sustainability. So we have sustainability for the environment, we're decreasing trash. We have economic sustainability. The Anti-Dengue Permit will eventually fund the rest of this project past the 5 years. We're going to be training and educating community members. We're going to be celebrating vaccinations, as Portia talked with the Dengue Awareness Month, and we're going to have multiple partnerships with the government. As I had mentioned, we do have quite a few partners, and having these in-person Cambodian partners, such as Husk Cambodia, the Coconut School Foundation, will really help building trust with our community so that it will promote vaccine hesitancy as we build that trust.
Okay, now talking about the budget, we'll be needing about $500,000 to fund our initiative. We will be needing about $50,000 for dengue prevention incentive. By that, we mean free repellents and bed nets. For teachers training and developing a course in Cambodian language, it will be about 30 minutes long course, not very long. We'll be needing about $120,000. To organize the Dengue Awareness Month, we'll be needing about $90,000. For travel and accommodation, we'll be needing $40,000. Staff and office overhead and data collection, everything is included in this category. We'll be needing about $100,000. For lobbying for anti-dengue permit, we'll need about $60,000. When we looked up how much it costs every year for lobbying for a legislation, it takes about $15,000, and we'll be doing it for 3 years. So three times 15,000 would be 45,000, but we kept a $15,000 buffer for the anti-dengue permit because we'll be generating a lot of revenues from them. And for our emergencies, we kept about $40,000. Last but not the least, we want to talk about the timeline. Our project will be divided in 5 phases. In phase 1, which is from month 1 to 6, we'll be going to Cambodia and do a need assessment, and we'll be identifying who are the stakeholders that we can partner with. We'll be signing memorandum of understanding with them. We'll be recruiting staff and collecting data from the very moment that we go there. And in the phase 2, we'll be lobbying aggressively for the anti-dengue permit, ADP. And we'll be also building a course for teachers, and we'll be training the teachers as well. We'll also organize Dengue Awareness Month, as Portia has talked about, and Bring Trash, Get Toys initiative for the kids. In the phase 3, the notable difference that you'll see is, which is year 2 and 3, we are hoping that by year 3, we will be passing the ADP legislation will be passed through the National Assembly. And in the phase 4, which is year 4, we are hoping to get it implemented. And in the year 5, we'll do a final review and community handover of our project to our partners. So, and our regular activities of teachers training, Dengue Awareness Month, Bring Trash, Get Toys, this will continue throughout the 5 years of our stay in Cambodia. For monitoring and evaluation, our team believes that it's a continuous process. We will be doing a quarterly review and an annual review of our activities by the data that we collect at the beginning and throughout our project phase. So that's it from our part. Thank you so much for listening. We want to thank Sparkman Center and Lister Hill Public Policy Center for giving us opportunity to present. And we also want to thank our mentor, Dr. Padilla, Dr. Lars Padilla, for helping us with our presentation. Thank you all.
Great, thank you. I am really exciting to see such a multi-level project. I can just jump in with one question quickly about the anti-dengue permit. So you're counting on people to violate that a lot in order to generate funds for the project. So, I mean, if you're actually getting your messages out and getting the society to take better care of their trash and things, but you're counting on people to violate that stuff so you can get money for the project. Am I misunderstanding that?
No, you are correct in a way, but what we have seen is, reaching out to people takes a long time, and and education is a very, very tough sell in anywhere you go. But in a developing country like Cambodia, it's very tough. And what we are looking at is, when we looked up online, there are a lot of construction sites which are breeding out for these mosquitoes. And right now we want to generate as much as money we can from these. And also, if people are not paying fees, not paying penalties, we don't need them to clean the cities, to be honest, right? So our goal is, those who are willing to learn from us, we are going to educate them. But those who are keep on violating, we'll be bringing money from them so that we can clean their mess in the first place.
Okay, nice answer. Thank you. What other questions do we have from judges?
Yeah, so I'm curious, from a viewpoint, from a U.S. perspective, Awareness months are something very commonly accepted, but how does that culturally translate to Cambodia? Is that something that they are familiar with and would accept and embrace?
So as Portia, one of our team member mentioned, in Philippines, which is a neighboring country, they already have a dengue awareness month in June. So, and they're very similar in the population, religion, and almost every aspect. They already, in Cambodia, they already have HIV awareness month. We think if they really want our opinion as an ASEAN task force to come up with a recommendation what they can do, we think that they should take this seriously and educate their people. Because to be very honest, vaccine is expensive. They don't have a lot of vaccine at their hand. And also the vaccine is effective only on people who were infected with dengue before. So that's why education is something that we have to target very aggressively, and we are lobbying for this particular policy.
Wonderful.
I have a question. Thank you. It's about the teachers training piece of your project. I'd like to know more about this. First of all, tell me how you might involve teachers themselves in the development of the training, but also what do you intend the teachers to do with the training, and how you evaluate the impact of the training?
So basically what we want to do with teachers training is smartphone penetration is about 75% in Cambodia. So it's about 75% according to the data that we have for 2016. We don't have the recent data, unfortunately. So it's very high in rural areas as well. And with the limited funding that we have, it's impossible to think about going to, I mean, from 2006 to 2016, Cambodia built around 10,000 schools. We cannot even possibly go through these schools alone. So what we are thinking is, when we talked about this proposal, in grad school, we take a responsible conduct for research, RCR course. So a very similar type course, which will be very short, 20, 30 minutes, and they will get a certification at the end of the course. It will be in Cambodian language, and it will just basically make them aware what are some of the activities, as one of my team members have pointed out, what are some of the dengue prevention behavior that they can adopt, and they can ask their kids or students to adopt. So that's something that we want to do, and that's why we want to encourage, or we want to partner with the Education Ministry of Cambodia, because we are an international intergovernmental agency, ASEAN task force. So we hope that we can do that, and by that we will be hoping that teachers will be able to take that course online and get a certification, get motivated, and also kind of solve a problem that is killing people in that country.
And to expand on that point a little bit too, I think a big incentive that teachers may have is that this is an online certification. So it's going to basically bolster their professional career. Additionally, actually, this gentleman that you see in the picture is the funder of the Coconut School, and he's one of the educators that I think we would want to reach out to, and then he can suggest different educators to reach out to. Again, we're reaching out to him because he's already implemented a really great program that inspires kids to do something that's really good for them, which is recycling. We would want to use that type of mindset and framework that he's already implemented for the dengue initiative.
So I just wanted to add one more thing to what Hannah said. One thing that our team believes is that a lot of the plan that we have, a lot of initiatives that interventions that we are proposing, it will be basically done by Cambodian, not by us. We don't even know their languages. So we are just trying to find peace. We have already found a lot of organizations that we can partner with. So when we go there, in person, we are hoping to find more organizations and partner with them and elevate individuals and organizations in the community to solve the problem that they are facing.
How are teachers viewed from the research you've done in the communities as information experts?
In our research, the teachers are viewed very, they are very respected in the community, and also the religious leaders. But for religious leaders, we did not go for them because there are not enough incentive for religious leaders to speak, and political leaders as well. But we are engaging city officials by implementing anti-dengue permit because they can generate money for their offices using anti-dengue permit.
All right, I have a quick question. You're engaging children through schools. Have you thought, or do you have a plan for engaging the parents?
We are planning to engage parents in the Dengue Awareness Month. So that's our goal. In the Dengue Awareness Month, we'll be inviting the parents and kids to get educated and take a pledge on dengue, where they will be learning about what are the activities that they can do.
And also to expand on that point, I think Dengue Awareness Month is great because it's going to be kind of like a festival, or it'll have a festival-like feel with different stakeholder booths. So for example, we could get the Husk organization who are partnering with the Coconut School Foundation. Additionally, we're going to be launching that social media campaign. So Dengue Awareness Month and our social media campaign will really bring in young adults and adults into this conversation.
Someone gave in the chat, this is a good question, for the people enforcing those laws about the permits. How do you deal with corruption, and how are you going to create a community buy-in and create trust with the population about those permits, I guess?
I guess one of the things that we talked about is because we know that corruption is prevalent, that's why we are giving them autonomy over 2/3 of the money, how they want to spend to clean their cities, So that's why they have an incentive to initiate, to kind of make it a law, or to kind of legislate, to pass it to the National Assembly, because they will get 2/3 of the money. The city officials will get the 2/3 of the money to keep their cities clean. We are only asking them to give 1/3 to the cities and residents.
And again, that 2/3 is coming from, you can see in the graph, you see 30% to city council. So that's basically going directly to them, and they can do pretty much whatever they want with it. And then that 35% still goes to the city. We're just asking, okay, with this 35% city, you can decide what you want to do, but we just want it to be towards destroying breeding grounds. So that's where we can, they can be beautification of the city and different things like that. And it's all city run. So that's kind of the incentive for them to basically to abide by this anti-dengue permit.
Will your program be throughout the country? Will it be targeted to particular areas, urban or rural? And speak more to that, please.
I mean, our project will be throughout the country. That's our goal. Our goal is to reach out the people throughout the country. Initially, we will be identifying the hotspots when we go there, and we will try to make a bigger difference in the hotspot. But our end goal is we want to reach the people all over the nation.
Yeah, that's great. And then, and just to expand on that too, I think because our approach is so multifaceted, it's going to have a multifaceted approach when it comes to kind of implementing this in stages. So for example, for the anti-dengue permit, that's mostly going to be in urban areas initially, because that's where the construction zones are. For different things like teaching, we want that to spread. Oh, I just see that we hit our time.
That's fine. You can go on, I guess.
Okay. For things like teaching, we're going to want to implement that all over the country, versus things like Dengue Awareness Month. At first, it will likely be more centralized and then spread.